Hello and welcome to another episode of Moto Mental Health. My name is Mark Ali Bishop, and I am a professional mental health therapist. And I want to thank you for riding with me on our journey to emotional wellness. So today's topic is actually going to be, it's something that my colleagues and we get quite a bit. It's a question that is also often proposed to us. And it's, what's going on with the short session? It hasn't been quite an hour. Why is my time up? Why are you billing me for an hour and you haven't seen me for an hour? And so this question I actually want to address today. And this is what we call in therapy a clinical hour, or a 50-minute hour. And so basically what that is, we schedule clients throughout the day, normally from 45 to 50 minutes. And then we can actually bill for the hour. And so, but there's reasons why we do this, and I wanted to kind of go over those reasons today. And this is a very common question. So there's actually a couple really good standard reasons why, and so I just wanted to touch base on those. And if you have a question for your therapist about that, I want you to actually talk to them so they can maybe explain it in greater detail. But there's actually 4 reasons, and I'm actually looking at my notes just to make sure I catch them all. So the first one is collaborating with other professionals that the client is actually working with. And so what that will help us do is if I'm working with you, say around anxiety, and you have a doctor or you have maybe a psychiatrist that's actually giving you medication for anxiety, you're actually going to be seeing another professional just around the medication. And so as a therapist, I want to make sure that I'm actually treating my clients around what the medication's supposed to do. So if you have anxiety medication being prescribed to you, I want to make sure that our work is around anxiety. And so, and then there's other professionals that we speak with. It might be a previous therapist that you might have had. So I may need to contact that therapist just to kind of see what kind of work has been done in the past. And so that takes some time as well. And then another one is writing session notes. So after every session that we have with our clients, we want to make sure that we're doing thorough session notes. And so we're going to be talking about what was discussed, the topics that was discussed in session, and then also too, whether or not we hit specific goals in the treatment plan. And so the session notes just kind of gives us a little bit of guideline of where we've been and where we need to go as far as getting you emotionally ready to walk your journey without us. Number 3, it's giving us, as therapists, giving us time to kind of go into the next session. Sometimes, we might have only 10 minutes to kind of get ourselves together emotionally before we see our next client. So let's just say I see client A from 12 to 12:50, and then I have 10 minutes and I have a 1 o'clock appointment from 1 to 1:50. So once the 12:50 appointment's done, it might be a pretty heavy or intense emotional session. So I might need that 10 minutes. I might do my session notes later. I might do my billing later. I might just need to just kind of get my thoughts and my wits together and kind of, think about what my next client is bringing, and kind of get myself grounded. And then finally, it's really preparing also for the next client, because I need to know. I might be juggling 10, 15, 20 clients, maybe more a week. And so every client is kind of working on maybe different things. And so I got to make sure that if we're talking about anxiety, or we're talking about depression, or we're talking about addiction, I need to know the specifics of what we discussed in the previous sessions. So I might need to go through my session notes just to kind of do a quick recap and get some details situated before I see that client, that incoming client. So that's a few reasons why we're kind of doing a little bit less than an hour's work. So normally a typical session is going to be about 50 minutes, and so that's what we call a 50-minute hour. So I'm hoping that this might clarify some things. I know if I've had this question multiple times, I know some of my colleagues have, so it might be a question that maybe you had as well. So I'm hoping that this might have explained a little bit, gave you a little bit of clarity as far as that's concerned. So that's it for this particular session. The topic was going to be short and brief and to the point. The next session, exciting news. I actually have Road Stories up and running. So in my previous video, I explained that I attempted to get Road Stories up and going. I was having some mechanical issues with helmet and wind and microphone, and so I needed to kind of work on that a little bit just to make sure that the presentation was good. So my very first official Road Stories Motovlog will actually be uploaded soon. So be looking for that in the next 3 or 4 days after you see this video. And then so basically what that's going to be is just stories that I have on my own personal journey through life, and then also two stories that I have had with other clients. And I always believe that other people's stories can always help other people. So it is my first vlog where I'm actually on the bike riding. I'm new at it, and so please be patient. I'm hoping that the content is going to be solid, but it's very interesting to be able to ride and kind of talk to yourself. But I'm actually talking to you, but at the moment as I'm recording, I'm talking to myself and trying to stay on topic, but also too trying to stay safe while I'm out there riding. So a lot of the motovloggers I know and communicate with over social media tell me that I will get better as it goes. So I hope that it's fun for you. That's what the purpose of it is. If you've never been on a motorcycle, it gives you that experience of being on a motorcycle. But also too, because I'm on my bike so often, this gives me a chance to connect with you while I'm actually on the bike. So I'm hoping that you enjoy it. I'm hoping that it's a fun series, and so be looking for that very, very soon. If you like this video, please please subscribe. It's the only way that my channel can really grow. And please share it. If you know anyone that can benefit from these videos, please share not only this video, but you can share the entire channel and with somebody that it can actually help. So thank you for your time. I'm really excited, and I'm really just happy to do these videos. And it really gives me pleasure, it really gives me joy. And plus I'm doing something that I really love, which is riding motorcycles, which is my therapy. And so I want to thank you for helping me. So until we meet again, please take care of yourself, because you deserve it.